All right, so here we're going to take a look at chickenpox. And chickenpox is an airborne disease. It is highly contagious and it occurs primarily in children in the age range of 2 to 7 years of age. Humans are the reservoir and source for this virus, which is acquired by droplet inhalation into the respiratory system. The virus is highly infectious with transmission rates in susceptible household contacts of 65 to 86%. There is a vaccine for chickenpox. Um, the virus is enveloped double stranded DNA varicella zoster virus. It is a member of the herpes viridae family. There is an incubation period of between 10 to 23 days. And in between these time period is when small vesicles erupt on the face or upper trunk. They fill with pus, rupture, and become covered by scabs. Healing of the vesicles typically occurs in about 10 days. During this time, intense itching often occurs. Individuals who recover from chickenpox, they are subsequently immune to the disease. However, they are not free of the virus because there is still some viral DNA that resides as a circular episome in a dormant latent state within the nuclei of cranial nerves and sensory neurons in the dorsal root ganglia. For instance, if someone was supposed to become someone who was infected with the dormant episome, was to become immunocompromised for some reason by such factors such as age, cancer, organ transplants, HIV, or psychological or physiological stress, the viruses become activated and they begin replication. They migrate down sensory nerves, replicate further, and produce painful vesicles and sensory nerve damage. This condition is known as shingles or herpes zoster. It is characterized by vesicles in a stripe around the torso or one half of the face. It's typically described as a dermatomal distribution. Shingles is most common in people over age 50. In some cases, pain persists even after the vesicles have healed, a disabling complication called postherpetic neuralgia. There are antiviral drugs such as acyclovir or valacyclovir that can be used to shorten the duration of a shingles outbreak. Typically, these medications are not used in the treatment of chickenpox. They would be used for chickenpox only in severe cases or in immunocompromised patients. A vaccine for shingles is recommended for people 60 years and older. All right, so measles is the most contagious disease endemic throughout most of the world. However, it is no longer endemic in most of the developed world thanks to an aggressive vaccination program. Measles virus is a negative strand enveloped RNA virus in the genus Morbillivirus and the family Paramyxoviridae. The MEV genome encodes 8 proteins, 6 of which are structural. The MEV enters the body through the respiratory tract. It is an airborne virus, or it may enter through the conjunctiva of the eyes. The viral hemagglutinin protein to receptors on activated B and T cells as well as antigen presenting cells. This prompts fusion of the viral envelope and the host cell's plasma membrane, and the nucleocapsid is released into the host cytosol. The incubation period for measles is usually 10 to 14 days, and the visible symptoms begin about the 10th day. The initial symptoms is characterized by nasal discharge, cough, fever, headache, and conjunctivitis, which intensify several days prior to the onset of rash. Typically, within 3 to 5 days, a rash appears as erythematous maculopapular lesions that are at first discrete but gradually become confluent. This rash normally lasts about 5 to 7 days. Coplic spots. Coplic spots, which are red lesions with bluish white speck in the center of each, are sometimes seen on the mucosal lining of the mouth in the early stages of disease. Recovery from measles begins soon after the rash is reported, although progressive degeneration of the central nervous system, called subacute sclerosing panencephalitis, is a rare complication. There is no specific treatment for measles. However, there is an attenuated vaccine, which is the measles, mumps, and rubella vaccine, and it is recommended for all children. It typically provides lifelong immunity. All right, so rubella is a contagious disease that occurs primarily in children between the ages of 5 to 9 years old. It is caused by rubella virus, an enveloped positive strand RNA virus that is a member of the family Togaviridae. It's spread in droplets. It's shed from the respiratory secretions of infected individuals. Once the virus is inside the body, the incubation period ranges from 12 to 23 days. A rash of small red spots, usually lasting no more than 3 days, and a low-grade fever are the normal symptoms. Rubella is typically considered to be a mild disease, but however, if it in some case is contracted by a woman in her first trimester of pregnancy, it can lead to fetal death, premature delivery, or a wide array of congenital defects called congenital rubella syndrome. There is no effective treatment for rubella, so it's recommended that all children and women of childbearing age who have not been previously exposed to rubella be vaccinated. All right, so smallpox, which belongs to the family Poxviridae, is a highly contagious disease of antiquity. It is the only example of vaccine eradication of disease, but it is of concern should it be used in bioterrorism. The genome consists of a single linear molecule of double-stranded DNA that is replicated in the host cell's cytoplasm. Okay, so it was eradicated through the smallpox vaccine, which contained live vaccinia virus, but since it was eradicated throughout the world, they're not making the vaccine anymore. The last recorded case of smallpox infection was in Somalia in the 1970s. The reason why eradication of smallpox was possible is because smallpox has obvious clinical features and there are very few asymptomatic characters. There's only human hosts that act as reservoirs, and there's a very short period of infectivity, between 3 to 4 weeks. And furthermore, variola virus is generally transmitted by direct and fairly prolonged face-to-face contact. It can also be spread through direct contact with infected bodily fluids or contaminated objects such as bedding or clothing. So we have variola major, which is the most common severe form. It causes an extensive rash and a higher fever. It has a 33% fatality rate. And then variola minor, which is the less common form and is less severe, which has a fatality rate of 1% or less. Both forms are transmitted by direct and fairly prolonged face-to-face contact. Okay, so arthropod-borne diseases, also known as arboviruses, are viruses that are transmitted by blood-sucking arthropods, such as ticks, mosquitoes, certain types of flies, from one vertebrate host to another. Okay, so they multiply in the tissues of the arthropod hosts without producing disease in the arthropod host. Diseases produced by arboviruses can be divided into 3 clinical syndromes: fevers of an undifferentiated type, with or without rash, encephalitis, which is inflammation of the brain, often with a high fatality rate, and hemorrhagic fevers, which also frequently are severe and fatal. There is no antiviral therapy that is effective in treating arbovirus disease, although supportive treatment is beneficial. Therefore, detection of these viruses is by nucleic acid amplification and serology. West Nile virus, also known as encephalitis, is caused by a flavivirus, which is an RNA virus. It first appeared in the Middle East, and it is expected to have made its unexpected arrival in the United States, most likely via a mosquito. And then this mosquito first appeared in New York. West Nile virus is transmitted to humans predominantly by the Culex spp mosquitoes that feed on infected birds, such as crows and sparrows. Humans and other mammals, such as horses, infected with West Nile virus are considered dead end hosts because the level of virus in the bloodstream is not sufficient to transmit the virus to uninfected mosquitoes. Mosquitoes therefore harbor the greatest concentration of virus, and this is mostly in the time period of late summer and early fall. So there is typically a peak of disease season, which is late August, early September. The risk for disease decreases as the mosquitoes die when the weather becomes colder. Although many people are bitten by West Nile virus infected mosquitoes, most do not know they have been exposed because they remain asymptomatic or exhibit only mild flu-like symptoms. There is no treatment other than hospitalization and intravenous fluids. There is no human vaccine to prevent West Nile virus. Some of the symptoms associated with West Nile virus is fever, lymphadenopathy, rash, and only 1 out of 100 patients develop serious complications such as encephalitis. A direct contact disease is transmission of a disease from one person to another. It often requires close personal contact. For example, transfer of microorganisms between people occurs by direct contact with the infected person through touching, kissing, sexual contact, contact with body fluids and secretions, or contact with open wounds. Genital herpes is a lifelong infection caused by herpes simplex virus, predominantly type 2. These viruses have a very short replication cycle. The core DNA is linear and double-stranded, and the HSV2 envelope contains at least 8 glycoproteins. This HSV2 is usually sexually transmitted, although it can be transmitted non-sexually as well. Infection begins when the virus is introduced into a break in the skin or mucous membrane. The virus infects the epithelial cells of the external genitalia, the urethra, and the cervix. Rectal and pharyngeal herpes are also transmitted by sexual contact. It should be noted that both primary infection and reactivation can occur without any symptoms, and apparently healthy people can transmit HSV2 to their sexual partners or their newborns during vaginal delivery. This is known as congenital neonatal herpes. Congenital herpes is a life-threatening infection in newborns, affecting approximately 30 of every 100,000 babies per year in the United States. It can result in neurological involvement as well as blindness. So as a result, any pregnant woman who has active or new genital herpes should have a cesarean section instead of delivering vaginally. So HSV2 is also associated with a higher than normal rate of cervical cancer and miscarriage. Some of the clinical manifestations for genital herpes includes fever, burning sensation, genital soreness, and blisters in infected areas. Blisters heal spontaneously, but virus remains latent and is periodically reactivated. It can be treated with antiviral drugs such as acyclovir. Human herpes virus 6 is also called roseola infantum, which occurs in infants and toddlers. It is a member of the family Herpes viridae. It is an envelope virus with an icosahedral capsid and a core containing double-stranded DNA that establishes latency in host cells. CD4 T cells are the main site of viral replication, whereas monocytes are in an infected latent state. In adults, human herpes virus 6 is commonly found in peripheral blood mononuclear cells and saliva. Since the salivary glands are the major site of latent infection, transmission is probably by way of saliva. So the tropism can not only include the CD4 but also the CD8 and the natural killer and the epithelial cells. Some manifestations associated with human herpes virus 6 includes pneumonitis in immunocompromised individuals. It's implicated in chronic fatigue syndrome, lymphadenitis, and multiple sclerosis in immunocompetent adults. There is currently no treatment or prevention measures. Warts or verruga are horny projections on the skin caused by human papillomavirus. Human papillomavirus is the name given to a group of DNA viruses that include more than 100 strains, some which are oncogenic, cancer causing. Okay, they differ in the types of epithelium they infect. Some infect cutaneous sites, whereas others infect mucous membranes. More than 30 of these viruses are sexually transmitted and cause genital warts. These are soft pink cauliflower-like growths that occur in genitalia and around the rectum. Genital warts are the most common sexually transmitted infection in the United States today. Acute viral gastroenteritis is inflammation of the stomach or intestines, is caused by 6 major categories of viruses. The viruses responsible for gastroenteritis are transmitted through the fecal oral route. It is one of the leading causes of deaths in childhood in developing countries. So here we see rotavirus, adenovirus, and astrovirus is attributed to approximately 5 to 10 million deaths per year worldwide. The symptoms are viral diarrhea, and it's typically transmitted through fecal and oral route. There is a rotavirus live oral vaccine. There's also a norovirus, which presents approximately 23 million cases of acute gastroenteritis per year. It's usually a self-limited disease. It's symptomatic, and basically treatment involves supportive therapy. Zoonotic diseases are human viral infections in animal reservoirs before transmission to and between humans. These are RNA viruses, and many are select agents listed as potential bioweapons. A number of viruses in this list include Ebola, Marburg virus, hantavirus, Lassa fever virus, and Nipah virus. Viral hemorrhagic fever is the term used to describe the severe multi-system syndrome seen in Ebola epidemics because the host vascular system is damaged. Vascular leakage, also known as hemorrhage, accompanied by the blood's diminished ability to clot, coagulopathy occurs. The incubation period for Ebola virus disease ranges from 2 to 21 days and is characterized by abrupt fever, headache, joint and muscle aches, sore throat, and weakness, followed by diarrhea, vomiting, and stomach pain. Signs of infection include fever, rash, red eyes, bleeding, and hiccups. Symptoms alerting of internal hemorrhage. Minor hemorrhage is symptomatic in all Ebola virus infection. Severe hemorrhage is late stage and may be minimized if patients are resuscitated in time. There is no standard treatment for Ebola infection. Patients receive supportive therapy consisting of balancing patients' fluids and electrolytes, maintaining their oxygen status and blood pressure, and treating them for any complications. Ebola virus is caused by Ebola viruses. They were first recognized near the Ebola River in the Democratic Republic of the Congo in Africa. They are members of the genus Ebola virus in the family Filoviridae, a group of filamentous negative strand RNA viruses. Prion diseases, also known as transmissible spongiform encephalopathies, are fatal neurodegenerative disorders that have attracted enormous attention not only for their unique biological features but also for their impact on public health. Prions consist of abnormally folded proteins that induce normal forms of the protein to fold abnormally. The group of diseases includes Scrapie, Kuru, Creutzfeldt-Jakob disease, and variants of Creutzfeldt-Jakob disease, Gerstmann-Straussler-Scheinker disease, and fatal familial insomnia. So, Scrapie occurs primarily in sheep. And the first of the prion diseases to be studied in humans was Kuru, which was discovered in the Fora tribe of New Guinea. Carlton, Gajusik, and others showed that the disease was transmitted by ritual cannibalism, especially where brains and spinal cords were eaten. So, the primary symptom of the human disorders is dementia, usually accompanied by manifestations of motor dysfunction, such as cerebral ataxia, which is the inability to coordinate muscle activity, myoclonus, which is shock-like contractions of muscle groups. FFI is also characterized by dysautonomia, which is abnormal functioning of the autonomic nervous system, and sleep disturbances. These symptoms appear insidiously in middle to late adult life and last months prior to death. Transmission is usually through medical procedures. It could be genetic or food